Well, I'll bet you I'm gonna be a big star. Might win an Oscar, you can't never tell. And who's gonna make me a big star?
You're watching the C-Spine Show. I'm Dr. Craig Callewart. Please like, follow, and subscribe. Today in Dallas, it's supposed to hit 106 degrees. Throughout much of North Texas, it's well over 100 degrees. And that stresses everything from the ground and foundation of buildings to pipes, to the animals out in the field, to the honeybees that I keep. Everything is struggling in the heat. And besides all the physiology of perspiring and losing body water, as well as losing body salt, it also has an effect on the other tissues. And one of the most common questions I have, both at the grocery store as well as in the office, is, hey, doc, what can I do to exercise my back or neck? And these are people who are asking me, people who probably exercise a couple times a month. These are not regular gym people. And what I like about this time of year, even though it's 105 degrees, is that water exercises can be really helpful for both the neck and the back. And again, one of the problems we all have with our low backs is we are seated. So we are folded at a 90-degree angle, and that naturally expands the tissues. That is, we are relative cylinders when we stand up, but when we sit down, we become pears. And so that compresses tissues, that pulls nerves, that stretches muscles, and done for hours on end, particularly at the computer doing this, it really starts to cause pain. So in trying to help somebody exercise and stay within their limitations, that is, they're not going to go be a gym rat 5 days a week. They're going to do something maybe twice a week. I really like water therapy. And the nice thing about water therapy is it's cool. It's outdoors, so you're getting the vitamin D. And again, vitamin D is very important for bone health. It is what helps the body take calcium that's floating around in our bloodstream and stick it and make it stick to bone. And bone is protein. So the vitamin D helps the protein calcify. And as long as we're talking about that, one of the problems in osteoporosis treatment or osteoporosis awareness is everybody thinks about calcium and vitamin D. But when you really sit down and do the math, most Caucasian older females just aren't getting enough protein. So you can take all the vitamin D you want, all the calcium you want, but if you don't have enough protein coming in, then you don't maintain bone health. So again, one of the reasons I like water therapy is people are outside and they're activating through sunshine the vitamin D so that it maintains bone health. The other reason I like water is we were talking about being bent. One of the great things about being in a pool of 20,000 gallons of water is the pressure that water exerts on the tissues. That is on the hips, on the back, and if you're in up and deep enough water, it goes around the shoulders into the base of the neck. So that hydrostatic pressure will help squeeze out swelling that occurs from misuse of the tissues, prolonged sitting, inadequate exercise, fluid retention from high blood pressure, too much salt, a variety of reasons that we all maintain and over maintain the water. So the hydrostatic pressure of the water against the tissues is like a massage, if you will. It squeezes out the excess fluids, the excess salts, and kind of that pear shape that comes from sitting. So the first thing I have people do is be in chest deep water, because you have the buoyancy of the lungs, and that will lift the spine up. And again, we are people who are vertical most of the day. So we are constantly kind of being pulled down by gravity. And if you do measurements of people. They're typically 3/8 of an inch to a half inch shorter at the end of the day because of the gravity effect on the discs and the tissues. It's squeezing them down. I mean, particularly for people with spinal curvature, scoliosis, where they have a twist, that force can be upwards of an inch a day. Of interest, one of the things I like to know is when I have people in the office, I want to know what time of day were your x-rays taken. Because it sometimes, not very often, but sometimes really makes a difference. If you're taking the x-rays at the beginning of the day, people are usually more upright. They are more hydrated, they are stretched out, and so their alignment's better, as opposed to the end of the day where, again, the effective gravity is drawing us down, squeezing out fluids and tissues, and changing the whole alignment. So water is nice because you're this deep. You are counteracting the effects of sitting in gravity by stretching out. So one of the really best treatments, particularly for couch potatoes, is just hang on the side of the pool and let you stretch out. Another way to do this is obtain one of those noodles, foam flotation that is about this big in diameter and will go underneath the arms, and you can just hang in the deep end of the pool and that will stretch you out. Some people take it a little bit further and will put ankle weights on in the pool and hang with weights on, or sometimes just water shoes are enough weight that, again, you distract it out. I have to give you a caution here that if you put too much weight on your ankles, you can go to the deep end real quick. Anyway, so just hanging in the water makes a difference in stretching out the neck. The second thing that happens when being in chest deep water after about 15, 20 minutes, and you have the hydrostatic pressure squeezing out the fluid from the tissues. It's also straightening your spine. So again, we are all sitters during the day. We are bent over like this. And so after you've been in the water for a while, a person straightens. And so what I tell patients with low back pain and hip pain is I want you to walk backwards. And so you're walking against the resistance of the water. You're leaning back into the water, walking backwards. And that, again, helps straighten the spine because you're going against the resistance of the water. The other thing to do is walk sideways because we all generally have fairly well-developed muscles in the front of our spine because we all walk forward. What we are almost all missing is adequate side muscles, side support to both the low back and the hip. And so that's why I say get in the water, get straight, 15 minutes of hanging, and then start walking sideways and walk backwards. So it's in the cool of the day, being in the water, you're converting vitamin D, you're then being stretched out, and you're able to exercise in the straight position. The next little more tricky, the ideal thing would be to have a snorkel and be in water above your head. And I do have patients that do that. But again, that's a little bit hard. So what I tell people do is be in water deep enough that you can float your arms. And one of the issues with the neck is, again, we're all bent forward looking at computer screens, on the telephone, whatnot. So our necks also are bent forward. And you can think of this as a 25-pound bowling ball on a stick looking at a screen. That bowling ball with the effect of gravity pushes us forward. So if you're in the water walking backwards, that tightens and strengthens the muscles around the shoulder blades. And those are the muscles that hold our heads up. So I'm asking people to walk backwards and do this gently with their arms. And that will usually hurt in land, but if you're in water this deep, particularly if you have little floaties on around the shoulders or even on a noodle, your arms are weightless. And then you can begin to start exercising your arms in weightlessness, which in turn pulls your head back and restores the alignment. So both those exercises are very good. For the low back, you have the ability to be in deep enough water where you're being stretched out. Not so much with the neck because the water is only coming this far, but one way around that is to float on your back. And if you're floating on your back, you're weightless. And so your spine stretches out a bit. And then you do this with the arms, and that helps strengthen the arms. The easiest way to float on the back is to have a styrofoam float. They look like rectangles or sometimes cylinders or sometimes even bean shaped that one puts between their thighs. And if you have that, then you don't have to kick and do all the stress to the low back and mid back of kicking. So you can just float on your back and do this with your arms. And again, that's a pretty good stretch and strengthening and reversal of that curvature that happens from being seated all day. So those are reasons I like water. Most communities have community pools. Hospitals have exercise pools. Many people have pools in the neighborhood or in their own homes. So it's a good way to be able to reverse the effects of sitting. So I hope you like this explanation about water and why it's beneficial. Please like this, please subscribe, please share. Thank you. You're watching the C-Spine Show. I'm Dr. Craig Callewart. Please like, follow, and subscribe.
Well, I'll bet you I'm gonna be a big star. Might win an Oscar, you can't never tell. And who's gonna make me a big star? 'Cause I can play the part so